The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
These days, people get their news and information from more media sources than ever before. Some of the news and information given are fake, unverified, doctored, and manufactured to create confusion, stir disaffection, and cause disunity. Before you believe or share any news, ask yourself, is this real? Is it from a credible source? Is it verified or verifiable? Fake news is dangerous, whether you do it for fun or for political gains. Real people can get hurt. Fake news, don't create it, don't spread it.
This is a public service announcement from NTA.
Welcome back to the Correspondents. Let's talk about drug addiction, balanced human right-based drug control in line with the international best practices has become imperative in the fight for the prevention of new HIV infections. HIV frontline response officers shared this opinion and advocated an increased sensitization on drugs, drug prevention treatment and care, especially among people who inject drugs. Correspondent Ifeoma Aikoje has the details.
Despite the increased risk for people who inject drugs, research has shown that they are among those with the least access to HIV prevention, treatment and health care. And this is attributed to the fact that drug use is criminalized and stigmatized. This has necessitated a recent call to action by the United Nations Office of Drug and Crime, government and HIV program implementers on improved, effective and efficient prevention programs and services, especially for people who inject drugs.
Drug use, and also tells us that the key population are actually one of the people that are involved in this, and they are the ones that have made new HIV infection to be as high as what we're seeing it now.
The attitude of the general public and the attitude of law enforcement officers towards drug use, as well as the responses that we currently had as a country to look at the situation. And from this assessment, we found that people generally didn't have knowledge, accurate knowledge in terms of drug-related issues.
People who inject drugs now account for 9% of new HIV infection in Nigeria, and the recent National Household Survey data on drug use records that the annual rate nationally is 14.4%, and the South-South region ranks the second highest with about 16% average, hence the call to action.
Looking at the drug use within the country, and we say that nationally the annual rate is 14.4%. Now, when you break this down into regions, that varies from, I think, 10% to 22%. And so different regions have different percentages or averages in terms of annual rate. And the South-South had 16%, if I recall accurately, and this is the second highest in the country. I think Southwest is the highest, followed by the South-South. But in terms of its being high, it could be for various reasons. Remember, you can't really place it. And I think the thing we have to keep in mind is that this is much higher than the world annual rate. And whether it's 10 or 22, it's a serious cause for concern in terms of the country's drug use.
Have to go out to our different governments in the states and say, hey, listen, there is an issue in the South-South. South-South contributes the second largest number of people who inject drugs.
On the way forward, stakeholders have provided strategic guidelines of the principles, key program elements and procedures for delivery and management of HIV prevention packages for this population.
People who are working in the field are sensitized, that they have enough content as they design the advocacy plans.
Then helps to increase knowledge and awareness. By that, you reduce stigma, and ultimately, once you have knowledge and awareness, you're able to evolve policies that are evidence-based and that would have greater impact on the society.
Yes, Ifoma, there is need for more sensitization on the damaging effects of drug abuse among Nigerians, especially the many youths. Thanks. And that's the Correspondents this week. Thanks so much for watching. Join us again next week on another edition. You can follow our Twitter handle at FUOLUA NTA #NTA Correspondents. Don't forget to use the hashtag NTA Correspondents whenever you make a comment or ask a question. And a quick reminder that COVID-19 is still with us. Continue to observe all the safety protocols and wear a mask properly. Take responsibility and stay safe. Bye for now.